Today I get my port put in for my chemotherapy, and with that I get one step closer to not being able to hide in plain sight anymore as a cancer patient who mostly, if not entirely, looks and behaves and acts well. It's one of the strangest things about being a cancer patient for me personally is that I don't look like I'm sick. I don't look like I'm walking around with a potentially fatal disease or condition. And this port is going to make it so, people will know, like, damn, something serious is going on for this guy. So the surgery itself, I'm not too worried about it. They said I'll be there for about 6 to 7 hours. I think the biggest thing I was bummed to find out was that I won't be able to exercise for a week or two, but that's okay. I'll be headed out of town, and I'm just trying to surrender to this experience in general and be thankful and stay connected and close to God. I will always say this every video, but thank you for being here for me. Good morning, my little companion. Good morning, everyone. I believe my first chemo starts in a week. I don't know what I'm feeling right now, but I don't think it's bad. I think that I'm grateful that for right now we have decided that we are not going to go traditional chemo as of yet. As of right now, we are going to use our repurposed meds, the peptides, and then this insulin potentiated chemotherapy, along with the metabolic therapy and dietary stuff is my approach. And I'm trying to make peace with that. I'm trying to feel good about that. I'm trying to feel grateful for that. There's some weird, strange mental battle I've been having about not going mainstream chemo to start with, but I'm trying to work through it. I'm supposed to stop drinking coffee now, and that shit's not gonna happen. It's 4:30 in the morning. I'm getting some coffee in me because I'm naughty. Don't tell my surgeon. Time is about noon. My mama came to pick me up. She's going to support me on this day of getting my port. How are you so far today?
How's your heart today?
I asked you first. Everyone who needs to know knows I have cancer, but having a port in is like, there's no hiding or...
No, I was going to say, it's like having a badge that says I have cancer.
Yeah, it's having a badge that says I have cancer.
I'm glad I'm with you.
Yeah, I'm glad you're with me. So we checked in at 12:30 at the, I guess you would say, the main cancer room. Now we'll go back and get me ready for this procedure. This all feels very mellow to me compared to the hemicolectomy. Nurse just dropped me off. Time to get changed for this procedure. Okay, so the anesthesiologist just came in. They checked in, wanted to know how I was feeling, asked me a handful of questions, let me know the procedure should be roughly an hour. Said it would depend on what the surgeon wanted, but one way or another, I would not be aware of what was going on for this surgery, which my mom and I are super pleased about. Check out these yellow socks. You can interrupt me anytime, by the way. No, you're good. Okay, they just placed my IV, and I have to admit that one kind of stung a little bit. That was a little bit of a stinger, but no big deal. They're gonna wipe down my chest now before going in. We did learn that this port goes under the skin. Doesn't have anything dangling outside of the skin. On a fun note, they've got me plugged in to this little guy, and it's just blowing warm air into my gown, which feels good because I'm relatively cold because I'm fasted, but I've never heard of anything like this.
We used to use warm, really hot blankets to warm you guys up.
Yeah, that makes sense. Yeah. This doesn't seem necessary, but what do I know? I was a little bit cold. It's nice. So on a more serious note, right after a lighter note, Mom and I are sitting here talking, and she brought up that I seem calm and she's happy. And something that I was thinking about today and Mom was reflecting on is that for me and for us, like, our walk with God, our walk with spirituality, our walk with faith is meant to be, and I want it to be all in, all or nothing. Not, I don't want to be a foxhole prayer person. That's something I did a lot in my life, and I'm here in the hospital. I have cancer. These are facts. These are realities. I have a procedure. This is a reality, and I just ask God to be with me. And I was telling myself this morning, God is everything or he is nothing, and in my mind, and what resonates with my soul is to that my God doesn't want me to be afraid if I can help it, that my God wants me to be content and calm if I can help it, grateful if I can help it. Anything else, Mom?
No, I'm proud of you. That is everything, because at the bottom line, the outcome is God's.
Yeah. So, can you tell me what's going on right this second?
Yeah, you just came back from OR. You're in the recovery room right now.
Mm-hmm.
You've just been here for like 10 minutes, so it's
Gotcha.
still there. Your medication's still there in your system, so you kind of feel loopy now, kind of groggy, but I'm sure you know what you're doing.
When you have a patient post-procedure, what's your job right now?
Well, my main job is to make sure the patient are vitally stable, because they're just recovering right immediately after the surgery, and no complications and no side effects from the medications. That's
How long are you supposed to look after a patient post-surgery?
It just varies, but on Noah's case, approximately 1 hour at least. Make sure everything looks good. Yeah, you did great. Everything looks great. You woke up this kind of loopy, obviously that's kind of expected, but otherwise you just nauseated. I give you some nausea medications. Pain
You did give me nausea medication?
I did, yeah. And I give you some oxy, obviously, for your pain, which
Okay.
is expected after.
Because they put a tube in my throat, right?
Yeah, that's why you have the pain as well in your throat.
Gotcha.
You during surgery.
Okay.
He's back.
Hi, Mama.
Hi, sweetheart. You look good.
It's good to see you.
It's good to see you.
How are you?
Much relieved.
Yeah.
Yeah.
How is your weight?
Long. Let's see what we got.
What do you see?
Look at that. That's under your skin. How can I touch? I can't,
I
because
think
it's.
so.
Oh yeah, it's got plastic. Oh, did you touch it? Go ahead. Go ahead. It's like a button.
Oh, interesting.
Wow.
Yeah. My throat hurts.
Oh, intubation.
Yeah.
Yeah.
It feels like I have something tugging on me, but it feels okay. I'm happy to be safe. I'm happy to be out of surgery. Before I forget, this is one of the things I was saying right before I went back. As far as working out goes, you guys all know that's important to me and us.
Yes.
He just said, listen to your body, wait
Yeah.
for the the numbing agent to wear off enough to be able to
Feel
listen to my body, make sure I can feel the pain. He doesn't foresee there being a major issue. I thought I was going to have to wait a week
Yeah,
or
I did
two,
too.
but he said a day or two should be okay. Just be careful. He just said most people don't work out like we work out, which is cool. Yeah, surgery went well. That went great. I look forward to going home. Good job, team. One more step closer.
Yep.
Oh, I told my mom this, but apparently the moment I could speak, other than saying I felt nauseous, which I don't remember, I started asking if he could pull out his phone and start filming, which is pretty funny.
And then that's twice, because
Yeah.
you forgot that you asked the first time.
Yeah, and then I said, do you have a phone? Can we film? He goes, again?
That's great.
It's pretty funny.